Welcome to the Precision and Population Health Fireside Chat. I'm Melissa Bondy, Chair of the Department of Epidemiology, Co-Director of the Center for Population Health Sciences, and Associate Director for Population Sciences in the Stanford Cancer Institute. And I'm delighted and honored to have this opportunity to discuss the topic of precision health with Dean Miner. As you know, Dean Miner has been in the forefront of precision health and recognizes its importance for the future. And I cannot think of a better person to kick off this initiative.
Precision medicine is about sick care. And for sure, if we have cancer or another severe acute disease, we want precision medicine. We want treatments that are tailored to us as individuals and tailored to the characteristics of our disease. Precision medicine, therefore, is about sick care. Precision health is about health care. It's about how do we keep ourselves healthier and in good shape, out free from disease, or if we can't prevent disease entirely, then how do we diagnose it much earlier and therefore treat it more effectively? There are some stark statistics that are worth remembering. If you just take a relatively small geographic area like Washington, D.C., the District of Columbia, there's as much as a 33-year difference in life expectancy between different neighborhoods in the District of Columbia. It's shocking, and it should be completely unacceptable in our country. And you don't just have to look at Washington, D.C., look at a variety of other metropolitan areas, other areas in the United States, these stark differences. And of course, they track directly, the differences in life expectancy track directly to socioeconomic factors. We still have, within a relatively short distance of where we live and work here at Stanford, we still have areas that have food deserts. Certainly, we've seen areas in which testing has been scarce. We've done a lot through our healthcare delivery system to address that. And also in the state of California, we've seen marked disparities in the uptake and distribution of vaccinations for COVID related to socio-demographic factors. Those are some of the examples, but so what are some of the common social determinants of health? Well, certainly access to healthy foods, access to health care. It's easy to talk about living a healthy lifestyle and getting exercise. It's much more difficult to do that if you're in a neighborhood where it's unsafe to be outside on the streets because of violence. I mean, these are all factors that have huge impact on the health of individuals and individuals in a population setting. And they've received comparatively little attention. Now, I'm not suggesting for a moment that we should back away from providing the very best medical care and indeed providing the most technologically sophisticated and scientifically informed medical care, which we're known for here at Stanford. But unless we also address the social, behavioral, and environmental factors of health, we're never going to have the type of impact that I think we know we can have on overall health and well-being. But what we've seen is unless we address the public health measures, and again, COVID has underscored this, unless we address those in parallel with the individual health needs, we're not doing service to our patients. So I hope in the future, this dichotomy between public health and medicine will become less and the fields will converge in ways that actually promote health and well-being. And I think we have a unique opportunity here at Stanford to do that. So our ability to innovate and then bring those innovations into a clinical care environment is I think, unparalleled here at Stanford and will continue to grow in the future as we build both our discovery-based enterprise and our healthcare delivery enterprise and connect the two with effective translation, as we're doing, for example, with the Innovative Medicines Accelerator. But it really does come down to people, and people with an entrepreneurial spirit, people who don't accept the status quo, but want to go further than the status quo and have real impact. I think all of us, each of us as individual leaders, as individual faculty, have opportunities to communicate. I've tried during COVID through a number of national media appearances to talk about what the virus is, what we know prevents its spread, talk about vaccines, and answer questions that that people might have about concerns they may have over either transmission or so-called non-pharmacological interventions, but really trying to communicate in ways that are meaningful in communities far beyond our our world here at a major research university. And each of us can play an effective role in doing that in our own way and through whatever organizations we happen to interface or interact with. I think that's a way that we ultimately, it does worry me a lot that we are in a very anti-science period right now. And I think coming out of it is going to require a sustained area of
Mhm.
focus on talking about what science is, what it isn't, what it can do, and what it can't do.
I agree, and I think we have some very talented community engaged types of people in our groups, and I'm hoping that we can overcome some of those concerns that we have had in the past. And it's just going to take work. And I think that COVID is an example of the difficulties, and it's really been so evident of where the disparities really are around the country. And I'm hoping that that's just maybe one of the ways that we can move forward and do a better job at it, and working with the community partners that we've developed and the trust that we're gaining in the community.